Good morning, social media family. It's Regina DNP, and I want to welcome you to this week's Wellness Wednesday. This week, we're going to discuss anxiety, depression, and cosmetic self love. As you know, we now have expanded our business to include post op, healing, and also body contouring work. And in talking to clients, we have found out that there is a mental health component that is involved in deciding to have cosmetic self love surgery. After cosmetic self love surgery, there are financial, there are relationship issues that can arise when you have cosmetic self love surgery. So, we wanted to just kind of take a moment and actually discuss some of the issues that we have found. So, one of the things let's talk about first is depression. So, with depression, you guys know I have introduced this particular book to you before. This is the diagnostic standard manual that a lot of mental health professionals actually use when we're doing diagnoses for mental health. So, one of the things we look at with depression, and there are many different levels to depression. So it could be major depression, major depressive disorder. It could be cyclothymic disorder. It could be dysthymia. So there's a lot of different things that can happen. And I'll work on doing maybe some YouTube videos to actually break down each one of those disorders. But one of the things we look at when we are assessing depression is we ask you about your sleep. Is it increased? Is it decreased? We ask you about, there's a term called anhedonia, whether or not you have interest in actually doing things, interest in getting out of bed, interest in going to work, interest in being with family and friends. So we do ask about anhedonia. We ask about guilt. Do you have any regret? Do you feel worthless? Do you feel hopeless? We also ask about your energy levels. Do you feel like your energy level has gone down with depression? We also ask about concentration. Are you able to focus on task? We also ask about your appetite. Is it increased? Is it decreased? We ask about like psychomotor movements. Like, do you find yourself moving a lot? Or do you find like your movements are really slowed? So, like psychomotor retardation, slow, or psychomotor agitation, like you're moving around really fast. And then we also ask about suicidality. We ask you if you have any thoughts of suicide, if you have thoughts of wanting to hurt someone else. If you do have thoughts of suicide, we ask you about a plan. Do you have an active plan to carry out the act? Or do you have passive suicidal ideation where you just kind of wish you weren't alive, like you wish you would go to sleep and not wake up? So let's get into some points about anxiety, depression, and cosmetic self love. Cosmetic surgery, cosmetic self love surgery, cosmetic, there's a lot, and it's really been on the rise and on the increase. Generally, when you do plastic surgery, that is like a plastic surgeon going in and literally modifying a part of the body. So let's say um, someone who has like breast cancer, they go in, they remove the breast, and then they go back and they put implants in. Cosmetic surgery is where you want to modify an existing structure on your body. You want to make it more appealing to you. And so there's a lot that goes on in the thought process of actually deciding to do cosmetic surgery. So there's always like the financial aspect. You have to think about what's going to be done after the surgery. And then you have to think about the relationships of the people around you. How are they going to react? How are they going to feel? So, with this particular topic, it's important to note that some people do experience anxiety. Some people experience depression following cosmetic surgery. Not everyone does. And, we're all individuals and we all walk, our own paths as far as how we deal with things. But here are some reasons why a person who has experienced or who has had cosmetic self love surgery done, some things they may experience. Some people don't tell anyone they're actually having the surgery. Some people do tell family about it. There will always be questions about finances. Is it financially feasible? There are things like jealousy. that comes up. It could be jealousy from a spouse, jealousy from a friend. So let's go into our point number one. Unrealistic expectations. Anytime you go and you have cosmetic self love surgery, or you can call it an elective surgery, you really need to make sure you have number one, a surgeon who is board certified to actually do the procedure. Go and get reviews. Find out from other patients, how was the surgery? How was the support after the surgery? Was the office very attentive? Now, even with that, we know that a lot of people are going out of the country to actually get cosmetic self love surgery. Of course, some of the hot spots in the US, of course, you have Miami, but every city has a cosmetic surgeon who will actually do the surgery. You also have Dominican Republic, Mexico, Thailand, Istanbul, and Turkey. So there are like some major hubs outside of the US that are actually carrying out these surgeries. And I want to caution you because there are surgery centers and then there are the actual private surgeons' offices. In surgery centers, those are more like a hub where doctors independently come in and they perform the surgery. You will have like office managers or you'll have a liaison who really works for the surgery center, not necessarily for the doctor when you go outside of the country, but even inside of the country. So you need to make sure that the surgeon, you speak with the surgeon, not just the surgery centers, because that becomes vital in the aftercare after your surgery. So if you're going to go out of the country, make sure you get to talk to the actual surgeon. Because if you don't talk to them and you're dealing with the surgery center, remember you're going to deal with possible language barriers. You need to know before you go there, how are they going to manage your pain? How are they going to manage complications if they arise? What is the post op procedure? How long will you have drains? Will you have drains? When will your massages start? So, those are all valuable questions. And then also, is your pain management included? Are the antibiotics included? Because you don't want to get there and then all of a sudden they're like, oh, $400 for pain management. Oh, it's $200 for the antibiotics. You need to get a breakdown of all of the services that will be included. Do not take, oh, well, when you get here, we'll give you that. No, you need that upfront before you go into that surgery. Now, so let's talk about point number one, unrealistic expectations. So whenever you go into surgery, that is trauma to the body. So whenever you have trauma, you're going to have inflammation in that area. So expect to come out of surgery with some swelling. There may be redness, there may be bruising. So don't think you're going to go into surgery and come out looking the way you expected. And you want to make sure that your surgeon has photos of before and after of their clients so that you can see their actual work. So, with these expectations, some people experience depression because when they get out of surgery, they didn't realize that, oh my gosh, I'm going to be swollen. I'm going to have all of these drains. And they just didn't know the time frame that it was going to take for their body to heal. Whenever you go and have surgery, you need to have a plan for post op. Who is going to take care of you post op? Who is going to help you with your drains? Who's going to help you bathe? How are you going to eat? If you're going out of the country and they say, oh, you're going to stay in the post op recovery facility, how long will you be in the post op recovery facility? 1 day, 2 days, 3 days? Will there be nurses 24/7? Who will you contact in the event of an emergency? These are very important questions to ask, but your expectations need to be realistic because when you stand up post surgery, you're going to feel some shifting because of gravity. Gravity is going to pull fluid. Fluid is going to pool in certain parts of your body. There will be swelling. You need to know all of these things and have realistic expectations after surgery. Our next thing is body dysmorphic disorder. This is something that I will definitely do a YouTube video on. You can find me on YouTube under Regina DNP. And body dysmorphic disorders when you have a distorted perception of your appearance, and you'll focus, on what you believe to be a flaw. And what you have to understand is cosmetic self love, cosmetic surgery is not going to alleviate any type of distress. So, if in your mind you feel like you're not pretty enough, you're not buff enough, you really need to honestly go through a mental health assessment. You need to be assessed if you have body dysmorphic disorder and actually get treatment. Go through talk therapy, have some counseling, go through some cognitive behavioral therapy, because having cosmetic self love surgery is not going to change you here. A lot of people think I go into surgery and everything's going to be fine. There's a lot that goes on after surgery that you really need to bear in mind. So, body dysmorphic disorder really needs to be addressed. Sometimes we do medical weight loss in our clinic because we operate in Texas, we operate in Nevada, California, Florida, and soon to be Minnesota, and eventually Washington State. We'll go back there. We have people who will contact us. They will have a BMI, um, a body mass index of like 24, but they're asking for things like Ozempic, Wegovy, and I have to tell, especially the young ladies, I have to let them know your BMI is normal. I cannot give you this medication. I don't care how much money you want to try to throw at me. I tell everyone, prison blue is not my color. So we really need to address this because, the world and all these filters that people put on, and you think like, oh, I want to be slim like that. Oh, I want my skin to look like that. You are who you are. So going and changing things, you really need to assess why. Why do I believe I'm not beautiful? Why do I believe I'm not buff enough? Why do I believe I need to change and I need to go and have surgery? So body dysmorphic disorder, it's real. But cosmetic self-love surgery is not going to change you here. You have to work on your why. Why do I want this surgery? So, our next point is post surgery discomfort and pain. Pain is real. Even if you do like smart liposuction, 360 liposuction, fun sculpt, there's still going to be some pain because anytime you do anything inside of the body, that can be traumatic. And so you will have some pain and discomfort. And as I said before, you need to discuss pain management with your surgeon, not the surgery center, but with your surgeon. What will be my pain management protocol? That's very important because a lot of people don't know, like, oh my God, I am really in pain. And then, of course, anxiety and depression can come in. The recovery challenge. So, after your surgery, now what? Whenever you do cosmetic self love surgery, you have got to think about, okay, now after this, what do I need to do to get my body in the shape that you expect it to be, basically. So you really need to find a post-op therapist. I'm sorry. You need to find a post-op therapist. You need to find a body contouring therapist who has been trained well to actually do your post surgery um, treatments. So that's going to be anywhere from we call like the first week, that's like your post incisional period. And then you have weeks 2 through 6, weeks 2 through 8, which is also your post op period. And you want to make sure your therapist is trained because in the post op period, the majority of the treatment is like 80% hands. Then you can use some tools, but machines should not be used within those first 6 to 8 weeks. There are a very few tools that can be used to actually help break down seromas. That's where fluid gets trapped in tissues, and it's kind of like a little pocket of fluid. So there's only certain tools that can be used. You should not be put on a machine within that first 6 to 8 week period because it really depends on how well you heal. So you want to make sure you get a trained professional, okay, for that. So there will be limited mobility. There will be, like I said, you need someone to cook your food, to help you bathe. So those are very important things, and those services do cost. So you need to make sure that while you're basically planning out your finances for the surgery, that you also plan out the post-op period. Because when you do these type of surgeries, usually there's a lifetime commitment to body contouring and to exercising and to maintaining your health. You have to make sure you are prepared for the dietary changes that are required to maintain the expectation of the surgeries that you have had. So there are recovery challenges. Social pressure. We know, once again, social media with all of these filters, we may think our favorite celebrity, has a certain type of face, a certain type of body, but now we don't even know if they are using filters. So you got to be mindful of this. And so we have all these beauty standards, and there's really a lot of pressure going on right now. So you got to make sure, once again, that you have a realistic expectation. So with these social pressures, there's just, I don't know, you guys, there's just a lot of things going on. Full lips at one time wasn't in. Now everyone wants full lips. People want to, some people want to lighten their skin, some people want to tan their skin. So it's very important, once again, that you understand your why. Why do you want this cosmetic self love surgery? And you need to make sure it's a realistic thought and expectation. One of the other things that comes is fear of judgment. Some people, they're hesitant because they don't want to be judged for their choice of changing their nose, having breast augmentation, breast reduction, liposuction around the waist, doing tummy tucks, Brazilian butt lifts, fat transfer. So there's a lot. So it's very important that you know your why. And you don't want to come down on a person hard because of this whole post op period. Surgery is traumatic to the body. So it's very important to not go into judgment of a person, but you really need to talk. And if you have a spouse, a significant other, you really need to talk to them about your choice for the surgery. And you really need to, if family is important to you, you really should speak with your family about your decision to go through cosmetic self love surgery. Because once again, anxiety and depression can set in, and after surgery, you're vulnerable. So there's a vulnerability that occurs after surgery. And so you want to make sure that you think this entire process through. Some people have regret. So if the surgery does not turn out the way they expected it to, they have regret. Or relationships can be ruined because of this. Because sometimes, let's say after 12 weeks, you get the body that you wanted. Will your spouse become jealous? Will your partner become jealous now of your new appearance? Will your friends be jealous because of your new appearance? So there are a lot of emotions to consider. Friendships, relationships that can be lost because of the decision to do cosmetic self love surgery. So think about it. Really think about it. The word says a wise man counts the cost. So you really need to think this entire process through before going through it. Financial stress. Cosmetic surgery, we know in the US it is expensive. 10,000, 15, 20, 50, $80,000. And that includes hair transplants too. So it's very pricey, which is why some people go out of the country. And once again, I am not an advocate of going outside of the US to get surgery because there are so many other factors that must be considered when you decide to go out of the country. So the financial stress is huge. So you already have the surgery. Now you really need to have, I'm going to say, 40 to 50% of the money you pay for that surgery, you need to have an additional 50% of that amount set aside for post op care. Because if you are expecting your spouse to be their hand and foot when you have children or not, or dogs, you really need to think this process through because you need to have aftercare after surgery. There are people who specialize in post op recovery houses. We have a room designated here that we will do post op recovery services for you. So it's important to make sure you have, and I'm not saying your best friend can't watch you, quote unquote, but you really need to consider having a registered nurse available or be in a post op recovery center where there's 24/7 care. And I'm going to say for at least 48 to 72 hours immediately post the procedure, you need to have registered nurses, physician assistants, nurse practitioners, medical doctors. You got to have access to them because things can go bad very quickly. So you need to be monitored to make sure you don't have complications. So that's very important. So once again, with the financial stress, you've got to set aside monies for post-op care. You must. So another thing is some people just aren't prepared for the emotions they feel afterwards. So it's very important to know that it is a process when you do cosmetic self-love surgery. It's a process and things can go right, things can go wrong. So you got to have finances set aside for it. So some people become so focused on the physical changes, they don't think about the emotional changes that will occur with the surgery. When you do Brazilian butt lifts, liposuction, mommy makeovers, breast augmentation, you have to wear compression garments. And I've had something similar to a faja years ago, just, because I wanted to contour my body using something similar to a faja. Fajas are very uncomfortable. They're not comfortable. Because remember, you paid for a particular surgery because you want a particular result. Fajas are meant to compress, and you need to wear your faja for months, and you need to do some maintenance with your fajas. So the cost of fajas, you got to take that into account because fajas will cost you anywhere from $200 to $500. Okay, some can be in excess of $500. So you have to count that into the cost of your cosmetic self love surgery. So you got to be prepared. Okay, the psychological impact of surgery, once again, is traumatic. Even if you're doing smart lipo, there will be some pain post surgery. So you have to be prepared for that. Who's going to cook for you while you're in pain? Who's going to help you bathe? Who's going to help you get to the restroom? Who's going to make sure your bills are paid? How long can you be off from work? Do you have the time to actually recuperate and heal after surgery? And that's for any surgery. So, once again, you have to be psychologically prepared, emotionally prepared, financially prepared for this. So, it's important when you're considering to do cosmetic self love surgery that you thoroughly research the process. You can always contact us. You can also contact any TOSI trained treatment therapists. Tame Out, TAIMEOUT. They have a list of TOSI trained therapists, treatment specialists. Some of us are nurses, and we can actually help you with your process. Now, I am a family nurse practitioner and I'm a psychiatric mental health nurse practitioner. So I'm able to help my clients through the mental health process of it, and then also like the post-op recovery things to know. So you want to make sure you make an informed decision. Get all of your questions covered and speak with someone to make sure you're going to be okay post surgery. So, I hope you enjoyed this particular session where we talk about anxiety, depression, and cosmetic self love. Whenever we don't prepare for something, we definitely set ourselves up for stress, depression, financial issues. So make sure you thoroughly go through and look at every aspect of everything that will need to be covered as you get ready for your new process and your cosmetic self love journey. So, hopefully, I hope you enjoyed this particular session on Wellness Wednesday, and I'll see you next week. Coming soon, I will be doing a series on depression and the superwoman because any of us who are driven, we're going to hit some bumps in the road. So, I hope you enjoyed. Have a wonderful day, and I hope you enjoyed Wellness Wednesday. Bye bye. Remember, your health is your wealth. And also, if anyone is considering suicide, having suicidal thoughts, please dial 988, dial 911 if you must. Call a family, call a friend. Your health is your wealth. Have a wonderful day.